Hello, and this is Dr. Din at your service.
Can you explain Botox for migraines? How often do people have to do it? And what's the difference between Botox for your migraine and for the agent?
All right. So, Botox for migraine, the biggest difference between Botox for your migraine and Botox for your anti-aging and beauty is, first of all, Botox for migraine may get covered by your insurance in the United States. So if you have failed certain other medications, oral medications for migraine, and you are somebody who tried Botox and it totally helped you, then this might be one of the medications that you should totally try to get your insurance to pay for. However, when you do Botox for your migraine headaches, the dosage of that medication that FDA has approved is super high. Not only you get it all over here and in the middle of your forehead, you also get it in your neck. And sometimes if you have pain in your jaw, which is TMJ pain, which can sometimes turn into migraine headaches, they also give you around here, around your jawline. So if you are somebody who has not experienced Botox for migraine yet, this is something that is super important. Please try it. And there is essentially not much difference. The actual medication is the same. It's just the dosage that is different. Now for migraine headache, when they give the Botox, FDA does not recommend it in the crow's feet. So this area where these wrinkles tiny around your eyes form, this is considered a purely cosmetic area. It is off-label use when we use it over here. FDA doesn't approve it. So when you come for beauty Botox, which is for erasing wrinkles, at that point you can ask your doctor to give you a tiny bit around here. So there are some clients for whom their medical insurance does not cover the Botox, that's for migraine. So then at those people, they come to us and we give them the beauty Botox a little more intensely up here, but we also add some around their crow's feet because we think that muscle, otherwise they just get like a very heavy feeling on their foreheads, which a lot of people don't like. So pretty much that's the only difference. One treatment is, migraine is like from through your insurance Botox, and beauty Botox is somewhat different. It's like low dosage. It's super natural. We don't try to freeze your muscles. We want complete movement, and that's it. And basically Botox works by relaxing the muscle. So basically wherever you place the medication, it is a medication. So once you place it, it basically relaxes your muscle. And for migraine, sometimes you have to relax it super, like too much. But for beauty purposes, you don't have to relax it that much. You just have to relax it enough where you can still have all the movements intact. I think even the routine Botox that you get for beauty purposes should also not freeze you. And migraine Botox should also not freeze you. But some people like it frozen, and,
Is there any side effects to Botox for both migraines and for the anti-aging?
So the side effect for Botox is that, again, it's a muscle relaxer, right, Daisy? So when you relax a muscle group, sometimes you can relax it a bit too much. Sometimes you can relax it a little unevenly because it spreads a little unevenly. So especially when you're using it in heavy doses, it can sometimes be like leave a sense of heaviness around.
Can it give you a droopy eye?
It can. So droopy eye, again, can be a side effect of migraine Botox usually, because they give so much up here that you sometimes can have like droopy eyes and you feel as if you're getting droopy eyes. With migraine Botox, they don't give you around here, around the crow's feet. So you can get a little droopy eyed with that. So, but you can always ask your doctor, and some doctors will give you. Some will work with you.
Now, I have heard a couple of times you do the lip flip with Botox.
Yes.
How does that work?
So again, it is a muscle. So around the mouth also has this muscle which is called the orbicularis oris. It allows us to chew, eat, talk. So sometimes what happens is that you can put a little Botox around the mouth to relax this muscle, and it allows it to flip. It just allows it to relax, and it looks really nice, but it can have an impact on some of your words, how you speak them. So your P's and B's can be a little mixed. So sometimes when I have clients who are coming from, who are like basically talking in public, or who are like newscasters or stuff like that, or like actually people who have to talk to other people, for those people we do not recommend too much Botox around here, because that can alter the way their speech is heard. However, there are other models who are like doing it for the way their lips are supposed to appear in a picture or on a magazine, then that's different, and we can always add some Botox here. Also, as you get older, like in your 60s and 70s or even late 50s, you would see sometimes we can add some Botox around here to prevent smoker lines. But the Botox that we give you is such micro doses. They're so little that they do not cause like massive flips or anything. They just look very natural, but they're a little relaxed. So you're not able to purse your lip around here that much. It's basically placed so that your habit of pursing the lip, you get over it, and you can decrease the amount of smoker lines, which sometimes happen in people even if when they're not smoking, and that's that.
Can you also take medication while you do the Botox?
When you are on medications, if you are not responding to those medications, that's when you start Botox. So basically, if you're responding to the medications, then you may not need the Botox. But can you do Botox and still be on your migraine medications? Yeah, you can.
I know that the filler, once you get filler done and people don't like it, you could dissolve it. Can you do the same thing for Botox?
No. So filler is reversible, because there are fillers that are reversible, especially the ones we like to use are totally reversible. So if you don't like it, if this is not working for you, we can totally reduce it. We can remove it from your system. Botox, on the other hand, is like salt in a dish. Once you place it, it's going to stay there. You have to take it with it. It will take its sweet time to dissipate. So